My name is Cheryl Erickson, and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today we will be discussing Chapter 9 of Health, Safety, and Nutrition. Please ensure that you are reading Chapter 9, as the video does not replace those chapter readings. So today when we're looking at Chapter 9, we're going to look at health screening and assessments of young children and how that works in a childcare facility. To be perfectly honest, we don't have a screening protocol that ECEs conduct on a daily basis for the children in their care. However, in developing relationships and getting to know children, we realize that in overall, through observations and interactions, if there is some type of learning disability or a health issue that we might want to contact parents with. So when we talk about health and evaluation approaches, screenings a lot of times take place prior to a child entering a facility. We might realize that there is a little bit of a delay or something that we want parents to pursue regarding their child and their learning process. So we may ask a parent to consult their physician. We may ask for additional support. So those are kinds of things we do. There is a screening process that is done prior to children entering kindergarten, and they're looking at things like hearing and vision. So as far as childcare, health screening, again, we'll realize that maybe a child is behaving differently during the day and might take steps to take their temperature, question them as to what's happening with them that particular day. As far as daily health checks, we'll look at things like, do they have a rash? Do their eyes appear red? So it's almost just kind of as children arrive and you greeting them in the morning, just doing an overall check to see that they appear to be in good health. And we do conduct observations on children through our daily practices. We jot down things that we're noticing, things that children are interested in, and that's ongoing, usually in our daily communication books. Health history of a child is something that's really important, and as children enter your facility, parents are required to fill out information on their child. So it's usually an enrollment form that'll ask specific questions about your child. Have there been any diagnoses? Are there any allergies? Simple questions like that, and that gauges some health history. It shares that health history with a parent. We do not ask about immunization records. That is a parent's choice. It isn't regulated. So parents don't have to have their child immunized prior to starting in a daycare center. Parents may offer to share that information that a child isn't immunized, and that is really good information for us to know, especially in the event that something is going through, say, chicken pox or measles. It could be an issue affecting their child's health because they haven't been immunized, and maybe they will be more susceptible or come down with that type of illness. As well as health history gauges where a child is developmentally. So if there was a premature birth, that sometimes will affect a child developmentally, or if there was some other type of disability that was diagnosed, may affect where a child is developmentally. Early development, so again, when we talk about earlier, we can even go back to pregnancy. Sometimes that pregnancy and birth history dictates where a child might be as far as development and delays. So if the mother's had health problems during delivery, prematurity, child's birth weights are factors in there as well. And is a child meeting their developmental milestones to par is an important question that we want to know, and that is actually something we can gauge in our observations on the children as well. History of illness and disease may affect a child as well developmentally, as well as how we care for that particular child. So if a child does have an illness, a disease, a disability, we need to know specifically how to best care for that child so that they are safe within our environment. And so we may have a healthcare practitioner come in and teach us. There could be a health care plan created for that child that details exactly how we're to feed the child or what steps we need to take in the event of a medical emergency. So that will be specific to that particular child. Things such as meningitis may cause hearing loss or cognitive delays, and that's important information to know. A child may present to us with a hearing loss and developmental delays. It's important for us to know why. Knowing why helps you treat the child. It helps you plan for that particular child. Things like ability to participate will be affected. If you can't hear and you have a learning disability or a delay in learning, it could affect your ability to participate because maybe you're not hearing cues, maybe the plan is a little bit too advanced for you. So again, that's some specific planning for that individual child. And again, we need to know how to manage those chronic illnesses, so asthma, allergies, and so forth. And again, there's going to be some specific healthcare training through URIS is usually the practitioner that teaches us, and a URIS plan is created. And we'll talk about that more later on in the chapter. Immunizations, again, if anybody's talking to you about immunizations regarding a child in your care, and as far as students, you're all students learning about children and caring for children, there are some stigmas involved in immunizations and perhaps why people choose to immunize and not. That is a conversation really to have with your medical practitioner, your doctor, public health nurse, because really they are the experts as far as vaccinations, times that they should be given. There are set times usually for after birth when a child gets their first immunizations. There's a kindergarten immunization. So that's the person really that has the knowledge about that. And again, actually your slide does show that it's usually the first 6 years of life and then 9 to 12. And if immunizations are missed, again, I would have that conversation about how that vaccination should be done if they've been missed. Some of the misconceptions are that it's harmful to a child's immune system, autism. There's studies linked that says autism is brought on by immunizations, but then there's studies that say it's not the case. Things such as mercury have been found in immunizations. It could affect your growth and development. So again, for every type of con to something, there's always a pro, and it's up to us to do our due diligence as parents. And again, I just suggest, that's really a personal choice, a family choice, and to have that conversation with a professional about that. When we care for children, we're caring for them. We're ensuring that we're planning for them as far as growth in all 4 developmental domains. And we're also going to be concerned about their mental and emotional health. And history plays a key role in that as well, as to where a child may present to you during that first daycare experience. So we gauge certain behaviors in children. We have to give them the opportunity to get comfortable in our environment. When you're first starting out in a daycare, there's anxiety, there's the fear of the unknown, and we need to give children that opportunity to settle in before we can really gauge and evaluate where they are. So if a child has adjusted to the program and they've been in the center for a few months, and we notice that there's some issues, that they're not positively interacting with the other children. They're an older child, 3-4-year-old, where there should be some social cues there. It could be some type of health, emotional, mental. Cognitively, they're not understanding, they're not learning that process. So we're going to want to gauge that and find out what's happening. We're going to want to talk to the parent and plan some activities accordingly to teach skills as well. Depending on what that is, if it's aggression, a lot of negative, we really want to be on top of that and work with parents and find out what our supports are if it's something that we might be having a hard time managing. We want what's best for that particular child. Child's problems with ability to manage emotion. And again, it's also going to depend on the child's age. Managing emotions when you're 2 years old is a challenge. Self-regulation is still developing in that particular child. Crying a lot, getting angry, throwing yourself on the ground, that's pretty typical for a 2-year-old. It's not typical for a 4 or 5-year-old child. So again, we need to look at what's happening before the incident, the actual behavior, and what's coming after, do our observations, and have those conversations with our peers, coworkers, as well as the parents. How a child copes with change and stress is a emotional type of mental health issue, as well as presence of mental health and caregivers. So that could really spark some thought when you're dealing with behaviors. If a parent has disclosed that there is this, issue within the family, and there's concerns that it is something that could be inherited, and we're watching for signs, we're monitoring, because we want to really get the process or start the process of support, then we want to be on top of that to help the child and to help the parents and do what's best in that particular situation. So I have said in previous chapters that when we're caring for children, we're also caring for their families, and family health is really important. If you're healthy as a parent, you're going to better care for your child. If there's issues that you're struggling with, it could affect how you care for yourself as well as your child. So we want to gauge our relationships with families and make note of things that we're seeing, document things that we're seeing, and talk to the supports involved or suggest supports. We want what's best for the child, and so sometimes that is helping and caring for the parents and being there to offer the supports that are necessary. Home environment, we want to educate all our families regarding healthy lifestyles. We know that, for example, secondhand smoke. Firsthand smoke is toxic. Why wouldn't secondhand smoke be toxic? And how that can affect health. Often children, studies have shown that children who often have a lot of ear infections in toddler and preschool are often linked to parents that are smoking. And you don't even have to be smoking directly in front of your child. That smoke lingers on in your house, even if it's another room. It still goes under the door. It goes through the door when you open the door, and that has been known to contribute to ear infections, breathing issues, bronchial issues, asthma, things like that. So we want to really share that information, and that doesn't even have to be in a conversation. It's not our job to tell parents how to parent, but you could post that information up on a bulletin board, and it's something that they can read and learn about. How do we attain child's health history? And again, that's really information that you need to gather before a child starts in your daycare center. I like to gather that information and share it with the staff. It's all a part of getting to know the child. So not only does that enrollment information talk about the child's health, it talks about have they had previous experience in childcare before? how do they sleep? What kind of an eater are they? How do they get along well with others? Things that might scare them. So that's a really important document to teach you how to get to know the child and best prepare them for that transition into the daycare center. So very important that practice take place before a child enrolls. You want to review that information as well. If on that document it tells you that the child has allergies or asthma, again, those are long-term health issues that need to have a personal health care plan created. There's going to be some paperwork that a parent has to fill out, that the center is going to have to fill out, that is going to go to the public health nurse or the URIS nurse is what the term that we use. And they're going to create a specific healthcare plan for that particular child. That's our practice in Manitoba. And then what takes place is that URIS health nurse is going to come into your facility and is going to train you on that particular health care plan. So if a child has seizures, you're going to go through seizure training. They're going to teach you how to administer that medication. They're going to teach you at what time you give them the recovery medicine. If the seizure doesn't stop, at what point you call the ambulance. So you have all that information in front of you. You now know how to care for that child in a safe way. Health evaluations, so just some other notes that you might take notice of. Oral health. If you notice that a child has, spotting on their teeth or is complaining about their teeth hurting, I would have a check in that. It could be a toothache, it could be a cavity. If you notice a child isn't hearing when you're calling their name and you're behind them, all those things are really important to the child's development, and those are the pre-screenings that need to be done as far as school. If you can get on them before that, even better, because then supports come into place earlier. If you notice that a child isn't growing adequately, that's cause for concern as well, and you might want to have a conversation with the parent as well. And again, that may be talking to the family physician about that. So as a child comes in daily and you greet them, you're going to look at their skin. You're going to, they look healthy, happy. Do they look tired? Are there dark lines under their eyes? I might ask them questions. Did you sleep okay? Rashes, things like that on their face and skin. Are they scratching? There's a lot of skin rashes that can be contagious. So you're going to want to make note of that, because if it is something contagious, you want to nip that in the bud. You want to have that parent consult a physician and the child get the proper medication. There could be time that they need to be away from the daycare so that does not spread to the other children. If a child is feeling of pain, fever, injury or illness, we need to let the parents know that so that the proper medical attention can be sought out for that particular child. So that does conclude our Chapter 9 for today in Nutrition, Health, and Safety. Please do see your instructor if you need any further clarification on Chapter 9 or have questions. Also check in with your instructor to ensure that you haven't missed any handouts or assignments pertaining to Chapter 9.